Methylphenidate, commonly known as Ritalin, is a stimulant drug used in the treatment of Attention Deficit Hyperactivity Disorder, ADHD. It works by altering the levels of dopamine and norepinephrine in the brain, which are the neurotransmitters that regulate alertness, focus, and concentration. While it is widely used to treat ADHD, it is not without its potential risks and side effects. This video will explore the pros and cons of methylphenidate for ADHD treatment in order to provide an informed opinion on its use. It will also discuss the potential benefits of alternative treatments, such as exercising and dietary changes. Finally, it will provide advice on how to make an informed decision regarding the best treatment for ADHD. What is methylphenidate? Methylphenidate is a stimulant drug that is used to treat ADHD. It is a central nervous system (CNS) stimulant that increases alertness, focus, and concentration by acting on the dopamine and norepinephrine receptors in the brain. It is prescribed in either short-acting or long-acting forms, and it can be taken as a pill or a patch. It is widely used to treat ADHD in both children and adults, and it is generally considered to be safe and effective when taken as prescribed. Methylphenidate is a Schedule II controlled substance, meaning that it has a high potential for abuse and addiction. It should only be taken as prescribed and under the supervision of a doctor. It is important to note that methylphenidate is not a cure for ADHD, and it should not be used to treat any other condition, such as depression. How does methylphenidate work to treat ADHD? Methylphenidate works by increasing the levels of dopamine and norepinephrine in the brain. These neurotransmitters are responsible for regulating alertness, focus, and concentration. By increasing their levels, methylphenidate helps to improve focus and reduce the symptoms of ADHD. Methylphenidate can be taken in either short-acting or long-acting forms. Short-acting forms are taken several times throughout the day and last for a few hours. Long-acting forms are taken once a day and last for up to 12 hours. The dosage and frequency of methylphenidate will depend on the individual's symptoms and response to the medication. Pros of methylphenidate for ADHD treatment. Methylphenidate is generally considered to be safe and effective when taken as prescribed. It can reduce the symptoms of ADHD and improve focus and concentration. It is also relatively inexpensive and widely available. Methylphenidate can also be combined with other treatments, such as cognitive behavioral therapy, to further reduce symptoms and improve outcomes. Additionally, it can provide immediate relief from symptoms, which can be beneficial for those with severe symptoms. Cons of methylphenidate for ADHD treatment. Methylphenidate can cause side effects, including insomnia, irritability, headache, loss of appetite, and weight loss. It can also cause physical and psychological dependence when taken for long periods of time. It is important to note that methylphenidate is a controlled substance, and it carries a high potential for abuse and addiction. It should only be taken as prescribed and under the supervision of a doctor. Additionally, it does not provide a cure for ADHD, and its effects may diminish over time. Side effects of methylphenidate. The most common side effects of methylphenidate include insomnia, irritability, headache, loss of appetite, and weight loss. It can also cause physical and psychological dependence when taken for long periods of time. It is important to be aware of these potential side effects and to discuss them with your doctor before taking the medication. Other side effects may include dizziness, nausea, vomiting, dry mouth, headaches, and anxiety. Additionally, long-term use of methylphenidate may lead to an increased risk of heart problems, including high blood pressure, stroke, and heart attack. Alternative treatments for ADHD. While methylphenidate is the most commonly prescribed medication for ADHD, there are a number of alternative treatments that can be used to manage the symptoms of the disorder. These include cognitive behavioral therapy, mindfulness techniques, and lifestyle changes, such as exercising and making dietary changes. Exercise and dietary changes for ADHD. Exercise has been shown to be beneficial for people with ADHD. Regular exercise can help to improve focus, reduce stress, and improve overall mental health. It can also help to reduce the symptoms of ADHD, such as impulsivity and hyperactivity. Making dietary changes can also help to reduce the symptoms of ADHD. Eating a balanced diet that is rich in fruits, vegetables, and whole grains can help to improve focus and concentration. Additionally, avoiding processed foods and sugary snacks can help to reduce hyperactivity and impulsivity. Making an informed decision about ADHD treatment. When deciding on a treatment for ADHD, it is important to weigh the risks and benefits of each option. It is also important to discuss the potential side effects and long-term implications of any medication with your doctor. Additionally, it is important to explore any alternative treatments, such as lifestyle changes and cognitive behavioral therapy, that may be beneficial. Questions to ask your doctor about ADHD treatment. When talking to your doctor about ADHD treatment, there are a few key questions you should ask. What are my treatment options? What are the potential side effects and long-term implications of any medications? Are there any alternative treatments that may be beneficial? How can I manage the symptoms of ADHD without medication? Conclusion. Methylphenidate is a widely used medication for the treatment of ADHD. It can be effective in reducing symptoms and improving focus, but it also carries a risk of side effects and addiction. Additionally, there are a number of alternative treatments, such as exercise and dietary changes, that may be beneficial. It is important to discuss all of the available options with your doctor in order to make an informed decision about the best treatment for your condition. Thanks for watching.